Hello and welcome to Light Warrior Radio. My name is Dr. Karen Can, and I am the #1 best-selling author of Sensitivity is Your Superpower: How to Harness Your Gifts, Fulfill Your Purpose, and Create a Life of Joy. And today on Light Warrior Radio, I have a very, very good friend of mine. Super excited to have her back. And this time we have visual. Yes, we're on Zoom, so she can show it, do some show and tell with us. So I'm super excited, super popular as well, because today we are talking with DL Walker about foot pain, and not only that, resolving foot pain naturally without necessarily going to surgery. So I'm going to tell you a little story before I introduce DL. So years ago, my mom having very severe bunions. Mind you, she didn't have a lot of pain. She just wanted to fit it into nice dance shoes. That was her goal. She went to the surgeon. The surgeon said, "Oh, no problem. We can fix that. We're going to saw a little here. We're going to cut this out. We're going to saw that over here." And she heard the word saw and she almost ran out of the room. Okay. She's like, no, you're not sawing me at all. Right. She just like sometimes the language that doctors use, they don't really understand. Like people will really like take it, as a really traumatic thing. So she never got it done. She never got it done. And DL actually worked with her and me. And when we did the work together, and DL has actually a program that you can work on it yourself. I've learned some skills, which is super, super helpful. So whenever I have something going on anywhere in my body, actually, but we're going to talk about foot today, I can, using the skill sets that she has taught me, which you can learn as well, to help resolve some of those issues naturally. And so my mom actually never ended up getting surgery, and I definitely did not need surgery for my bunions. So glad I didn't even think about going down that road. And literally, I have absolutely no foot pain. So it's super awesome. So let me tell you a little bit about DL. So she is Bachelor of Science, Master of Science, Education, PT as well. She's a corrective alignment specialist, best-selling author, educator, internationally recognized expert in natural foot and ankle treatment with over 35 years in healthcare. She's earned degrees in physical therapy, fitness, cardiac rehab, exercise science, and advanced post-professional certifications in functional manual therapy. That's what I love. Have her come do on me when she comes visits. Health coaching and multidimensional healing. She's actually an activator healer coach, just like I am. So a teacher at heart, she creates coursework internationally for both healthcare professionals as well as the public, resolving dysfunctions ranging from bunions to balance and even just overall wellness. So she's taught and collaborated with professionals from sports organizations, including the WTA, the Tampa Bay Rays, the Washington Generals, and the PGA. She's trained Olympic athletes at the U.S. Olympic Training Center in Marquette, Michigan, as well as performing artists and celebrities. Also help friends of mine who are elite skaters as well in figure skating. So she keeps busy, just like I do, just learning and developing new healing strategies, honing her skills, teaching, coaching, consulting, creating courses, and helping it to people from all over the world heal from soul, as in bottom of the soul, to their soul. So really holistically. So welcome, DL. I'm so glad to have you back. Yay!
Thank you, thank you, thank you. It's wonderful to be here. You know, when you were talking about your mom, the term that I came up with is Frankenstein foot,
Mm.
because that is oftentimes what winds up happening to the foot with surgery. And sadly, the Frankenstein foot doesn't really focus on function.
Yes, yes. We're going to talk a lot about function today. And in fact, the other day, I think we were referring to you. Actually, I don't know if your ears got buzzy, but I was talking to somebody else about foot, and they were having you on, and they said, the results from bunion surgery are terrible. And I said, "Oh, really?" I mean, I just haven't been in Western medicine so long. She said, "Oh, yeah, I know so and so and so and so." And the percentage of, really good foot function after surgery is not that great. And I'm like, I'm so glad my mom never got the surgery because she actually is not in pain. I mean, her foot's
Right.
dysfunctional and she doesn't want to work on it, but she's actually
Sure.
not in pain. Yeah.
Absolutely, absolutely. I think the success rate's about 90%. So there's a 10% failure rate, meaning that the bunion comes
Mm.
back. And there's a bunch of reasons why. I mean, the
Yeah.
basic one is that they don't fix the root cause, or what I
Right.
call now the irritation, right? The initial irritant. And that oftentimes is found up the kinetic chain. And when you're just doing surgery on the foot, you're not addressing the forces that are coming from the top down onto that area. And therefore, because you haven't changed the root cause of the problem, that and the forces will continue to act on your body when you're walking, when you're in weight bearing, whatever you're doing. And therefore it predisposes that bunion to come back.
Yeah, yeah, it's interesting because, when we think about bunions or hamatoes or any of those things, in Western medicine, to be honest, our answer was always surgery. I mean, there was just nothing else. We didn't think about the rest of the body. We didn't think about alignment. And in PT, I mean, obviously you guys work on alignment, but you've gone way beyond the average PT and what they know. So tell us a little bit about your history and how you became to be this, foot and ankle expert.
Yeah, I think I was in the right place at the right time, and the universe kind of guided me to the foot, uh, and in many, many interesting ways. So I would have to say my journey started and concepts started coming to me my first day of orthopedics PT class. I would even say before that, there were lessons that I still remember to this day. But on that first day of physical therapy class, our teacher shared three things that you would do with any patient. And how I remember these things, I don't know. But the first was, and I've modified them quite a little bit. The first one is that you need to have stability in order to have mobility. The second one is to release, realign, reinforce, and I've kind of adapted that. So again, you release the connective tissues, you realign the body, and then you reinforce it with exercise. Right. And then the last one, I can't remember. It'll come to me. So we can move on. Maybe it's just not that important. Oh, yes, duh. Alignment. Alignment, or she said, structure dictates function. Structure dictates function.
Right.
I've now adapted that to alignment dictates function, force absorption, frequency, and flow.
Ooh, I love that. Yeah,
So
easy to
yeah, so
remember.
I've modified that. And fast forward in my career, I always knew the importance about posture and alignment. Once again, structure dictates function, or alignment now dictates function, frequency, flow, and force absorption. And I went to a class, 10 years, it was 10 years out of school. And I was treating patients. I had a business in Manhattan. I was working with patients in their homes, and I went to this one class that dealt with gait walking. And the teacher in the class, um, here I thought my posture was perfect because I was conscious of it.
And
And
you're an
she,
athlete, so.
right, and she just moved, but yet I had a history of back problems since I was about 13. But
Oh,
but my teacher then adjusted my rib cage over my pelvis. And I took 3 steps, and literally I knew nothing about energy medicine or energy at that time. I said to myself, I wonder how much energy I'm wasting in
mm,
my day by the poor alignment.
mm.
And I immediately signed up for classes and became certified in functional manual therapy. That was the background there. Fast forward, I studied with them. I became certified with them. I taught with them. Always knew I wanted to teach. And there was a advertisement to develop your courses, and we'll get you the students, and you can teach. So after I had finished a stint with that organization, I started teaching, and the subject they wanted me to teach was balance. Okay. So, did my research. And again, balance is awesome because it is so multidimensional. I mean, it's not, a body part. It's a real
Right.
integration of so many different aspects of our physicality. And then, beyond, what you and I study as well now. And I did my research and took what I knew from all my training and put a course together. As I was teaching the course, I was teaching the foot and ankle as I was, similar to the way that I was taught it, and I kept learning, and I kept noticing different things that I wasn't taught, and that was one component of it. And then I said to myself, well, well, people don't usually fall when they're sitting. So the foot's got to have a huge component to this problem. And really from a physical standpoint, it is really the foot and the pelvis. Falling is
Mm.
literally when your center of gravity, which is in your pelvis, moves beyond your base of support, which is your feet in standing.
Yes,
So
yes.
those two components I went into great depth. So you
Ah,
want stability at the pelvis, but you want mobility at the foot.
right. You
And
should have seen me yesterday at skating because my coach was like, "You're sticking your butt out." It's because I was not getting ankle dorsiflexion.
that's right, we compensate.
I
And
compensated by sticking my
that's
butt out.
right, right. And oftentimes everyone compensates. I say we're a manifestation of our compensations.
Yeah.
So it could have been a fall on the ice that has now caused you to compensate. It could have been,
New skates.
new skates. It could have been stubbing your toe. It could have been, running into, a tree. I mean, these traumas happen and energy is neither created nor destroyed. And over time, the body adapts. And what will happen is that by the time we have pain, we've often had major compensations going on.
Right. Layers and layers of them.
Exactly. Um, and to then go back with regard to the foot, I knew, or I was, um, after I finished all my schooling, which was basically in 1997, I I was done. I was working. I thought like I achieved everything. And I'm like, okay, what's next? I'm like, all right, what am I supposed to be doing? What am I supposed to do on the planet? And I heard create online programs that empower people to heal themselves. 1999.
Wow.
That came to me. So when technology came to the point where I could start doing that, I of course went to a beautiful mentor who you and I both know, and they said like you have to niche, you have to niche. And honestly, I was never comfortable with that.
Mm.
And but I did, and I'm like, all right, the foot. If I have to pick a spot that I know probably better than anyone that's going to make the biggest impact for the most people, it's the foot. Even though I am highly trained in the rest of the body and using the concepts I just shared with you earlier, I can treat any human, any animal, anything now, which is where I've gotten to in my progress, using those same principles.
Mm. Yeah, that is amazing. Well, and sometimes we make things really complex. We think, oh, you know what, this is well,
Right.
I gotta say, we love having you work on us because first of all, your eye, right? It's just training, and you're able to in an instant. It might me take me like 5 times longer to figure it out, but you can in an instant say, oh, you're caught there, right? And I'm often not looking at myself.
Yes.
Right? And
Yeah.
then you do the manual therapy and it hurts like heck, but it's awesome. And yeah, so I know how to do it, which is really empowering.
Yeah. And and in 10 seconds, your range of motion has just improved,
Yeah. Yeah.
like 20%,
Yeah.
30%. And then you go to the next place. And I think what's really exciting for me now is that you may or may not know, a couple of years ago, I think it was right before your wedding, that summer, I tweaked my hip, just moving wrong.
Mm, mm.
I had a couple of precursor tweet, oh, what's the word? Knocks, hello, something's going on here. And then of course I ignored it. And then I'm just really literally standing in the living room and I went like this and I heard
Oh,
a
that's like me at the airport the other day.
yeah, I'm just like clunk and I'm like and I was down. Like I
Wow.
love to walk. My daughter wanted to walk to the arcade. She was younger at that time.
Yeah.
And I'm like, I'm sorry, honey, I can't do it. And I
Wow.
never like I'm an
You're
athlete.
so
I suck
active.
it up usually. And I'm just
Yeah.
like, I really just can't do it. And so doing the conventional treatments that I've been taught, I was able to, get to different lanes and plateaus, but I've been compensating to the point that I am still compensating from whatever started that whole cycle that wound up with what I feel to be an acetabular tear, which I never did pursue diagnosis because in my mind, the treatment's the same.
Yeah. Yeah.
Unless I'm going to get surgery, which I won't, unless I am dying. Um, you know, the treatment is the same. So I just started treating it using the principles, but then going beyond, going into the, not just the body, but the mind and the energy.
Right. Right.
And to your point now, I restarted using a yoga class that I very much like locally. It's a hot yoga class, and it's modified. It's a modified Bikram, and the way that they modify it, and what I know, works phenomenally for myself
Mm.
because I'm able to understand what they're saying, and I'm able to to apply it to my body. I'm not sure everybody else in the class does, but I get so much out of it
Good.
because I can then go to the point where I'm about to compensate, and I know exactly now where I need to treat. Because just
Ah.
like I work with, clients and I observe how they move, I tune into myself and I'm like, okay, when am I compensating? And for some of the poses that I've done in other studios, because I've been practicing hot yoga for several years now, I used to go way beyond my range of motion, that my compensation, right? I went through my compensation. And as a result of that, I was never able to undo that particular dysfunction and probably doing harm to the rest of my body, which is what
Mm.
happens to most people.
Yeah, there's actually a book that my friend wrote about how to do yoga without getting injured, which is kind of sad to have to
Yeah.
say that, you know?
It is, and I have to say, it is, in my opinion, one of the more dangerous activities
Wow.
when you are not concentrating. And I wonder
Unaware.
if, right? Because that is the whole point of yoga, is to
Yeah.
really tune in. And when you can do that and really feel into your body as you're moving and be conscious,
Mm.
oh, when does my shoulder elevate? Oh, when does my lower leg come off the ground when I bend forward?
Mhm.
Like at that point, when you have a compensation or a change or something becomes challenging, that's the point that you need to treat. And that's what I've been practicing in my manual therapy practice for, decades.
Mm. Yeah,
So
I think
it's
I'm much more body aware since you've been
mhm,
teaching me, and realizing, and there's certain things that I know to work on, but I don't necessarily make time for. Like every time I'm in a skate boot, I know I'm compromised because the skate boot is like it's like a cast, right? And there
mhm,
there is no mobility in the foot, and where the boot presses against the side of my leg. I was trying to get more dorsiflexion yesterday. After I took the boot off, it was sore, right? Like that area, I call it, it was gallbladder 39. But anyway, but that area was sore. And I know that, yes, I need to work on that. So just as a testimonial, when I twisted my foot the other day at the airport, and of course, here I am, like barefoot, number 2 stone, like, like walking on the red rocks, don't tell anybody, in Sedona, barefoot, right? And I get to the airport in shoes, and I'm obviously not used to the rubbery shoes on this floor. And I, went one way and my foot didn't go that way. And I could feel the twist in my knee and went, uh-oh. So James literally goes, I'm going to DL you. So he grabs my knee and whatever, and he just starts feeling intuitively. And he didn't even take your course, right? But he knows what it feels like
yeah,
because you've done work on him.
right, right, right,
And he
right.
starts looking, and he goes, and he pushes, and I'm like, oh, that's fun. That's good. That's good. So he's releasing around my
Yeah,
shin, my tibia.
yes, yes, that's where the problem is.
Yeah, like all sorts of things. And like I could muscle test what the original, like where the injury is. It was like the lateral part of my medial, meniscus was not happy, right? It was a little bit distorted after the action.
Right.
But he just went, and he just intuitively just went all the way down the shin and up the other side. And really, and I gotta tell you, I mean, I literally stood up and went, that is a lot better. Like a
Right, right.
lot better, like immediately.
And the thing is that when we talk about force attenuation, right? If you're in a skate, one of the things I think that
Mm.
preventatively should be done is a rotational release. You know what I'm talking about, to the lower leg, to the tibia, to the fibula, right? Um, in all, in all directions. Because what's interesting, and I do have my little model here,
Yay!
is that if I want, and this is in my body, I have a higher arch, okay?
Mm,
So for me to get my foot in a better function, I need to rotate this way. So when I do that, you can actually maybe even
ooh,
see it. It goes down a little bit on that angle, right?
wow.
Now, when
Huh.
conversely, if I have a flat foot, I want to rotate
That
laterally,
way.
right?
Right.
Now, in order for the rotation to occur, let's say internally, right? For the high
Mhm.
arch, I need to create movement here.
Yep.
So if this is restricted and I'm trying to open this up, this is for therapists or anybody who knows my stuff, is that if this is stuck,
Mhm.
this is never going to move
Right.
unless I allow it to have the space to move too, right? It's almost
Mhm.
like there's a wall here, right? If
Yep.
there's a wall here, it ain't moving. I could be mobilizing here till the cows come home. It ain't good. Sorry. It's not going to move until I create that area that it can move to, right? The
Mm.
destination, so to speak. So, yeah, so that is something that a lot of people are all about, the stretching, right? Or the lengthening. But there's also, in order for something to lengthen, something else needs to
Shorten.
compress or fold.
Yeah, on the other side.
Right.
It could
So
be
if
a
I'm having
contrast.
difficulty bending this way, it could be a lengthening problem here, or it could be a shortening problem here.
Mhm. We never, I mean, PTs to some degree know that, but most people don't. They think I need to stretch, I need to stretch, I need to stretch.
Exactly,
Yeah.
exactly. And to your point, also going back to, you need to have stability in order to have mobility, right? Some people may not have a restriction, they might have an instability, and the instability is causing them not to have mobility.
Yes, and that's kind of sort of what my knee was feeling like, which is why I did some of your taping, because
Right.
it felt
Great way to do that.
unstable. And I knew, yeah, I mean, it was helpful for the pain relief for James to do that, but here I am like pulling luggage and all this kind of stuff. So it just felt better to tape it so it would feel stable. And I was able to skate. I was able to pretty much do everything I normally do, even squats and things like that, carefully, as it's healing.
And really, the problem with most people when they have pain, it's usually an instability.
Mm,
But
usually an
it
instability. Okay.
right. So there's typically, because again, think about a fusion, right? What do they do when somebody has pain in their neck or their back? They'll do a fusion surgery to stabilize it, right?
Yeah.
And the thing is that when something becomes unstable, it's usually becomes hypermobile first, so
Yes.
too
Yes.
mobile. Why
Yep.
is it hypermobile? Usually it's because there's too little mobility through the kinetic chain, causing the most vulnerable area to become hypermobile, like a knee. A knee
Yeah, and that's
is
why.
very, very, um, a knee is very, very,
Mm,
what's the word that I'm looking for? I'll put it this way, the foot and the lower leg are crucial to have fluid movement to protect the knee.
right.
Yeah.
Yes. And I
And
know that my lower leg could use a lot of work. I got to tell you, it's really tiring for me personally because I mean, I'm strong, but not that strong. For the foot, no problem. For the lower leg, I literally break out in sweat
oh
doing
yeah.
some of the techniques because there's so much pressure required. And also, I have high pain tolerance. So I can tolerate a lot to move that fascia.
Yeah, and what I find interesting too for myself in the yoga class, I will
Mm,
just, it will be exhausting for me to be conscious of my body and hold it to the point, like right before the compensation.
wow.
It is like, again, that's where the sweat pours down. I mean, some, like, just a simple leg lift is difficult because to do it do it right.
Right, right.
Which is, my new favorite line that we were just talking about. Um, to just do it right, I don't have to do a lot. I just have to do it right for a couple of seconds. And to your point, it is when it is that right spot, it is you have a response. Your body actually has a response, like
Mm.
sweat, um, potentially tears, potentially, um, yeah. So
Everybody don't go running away yet. You gotta hear the rest of this.
yeah, exactly, exactly. But with each step, it doesn't mean that you have to do a lot of it, but progressive, a little bit a day. And again, just being really, really mindful of how you're holding yourself, how you're moving, how you are exercising. And I really do feel I know where I am vulnerable. So I am super focused on those areas, and they're on both
Mhm.
on the right side of my body. Don't think about my left side hardly at all, a little bit. Um, because there is a spot in my foot, ironically enough, on my left side. But beyond that, my left side is great. My right side, not so much.
Right.
The
So
you
this
know,
is a
the
work in progress. I mean, even though the
Yeah.
technique that you're teaching is really, really fast, I mean, the results are
Mhm.
instantaneous. Like we had
Right.
those before and after of my right foot, those bunion pictures. It was very poor quality because I was in the hotel trying to take these
Yeah,
pictures,
yeah,
but in Toronto. But it was like literally like we almost regretted not taking the before picture because I really
yeah,
wasn't expecting anything.
yeah,
But then afterwards, I could visually see like that bunion was almost gone. And I was like, holy moly.
yeah,
That's incredible how quickly once we know the right spot, right,
yes,
to work on
right.
to make a shift. Yeah.
Yeah, and now I'm using more, I've gotten back into using something that I do use with motion. So when you have a bunion, what I'm doing now, when you have a bunion, and if you have one, you'll probably relate to this, is that when you are not standing, right, you can move the bunion into normal alignment,
Correct.
right? It's just when you stand up, a lot of times that bunion will go,
Right.
right? And I developed this technique. I've called it a lot of things, but I think now I'm calling it functional diagnostic evaluation, meaning that by watching somebody move, depending on whether that movement is in what we professionals call the open chain or closed chain, at the point of compensation, right? The bunion is a compensation. At the point of compensation, or when that bunion starts to go, "Eew," right? That's where the connective tissue dysfunction is. So for some
Yes.
people, it's in their thigh. If it
Uh,
happens like right away upon standing, it could be in their pelvis.
right, because you're always asking me if I say, hey, I, injured something or it hurts, you're saying
Right.
when. You're always
When?
going, when
When?
in the gate, when you move,
Yes.
does the pain occur? Because
Exactly.
it makes a difference.
Exactly.
Because and the on PT, they normally have you lying down and they'll go, does this hurt? Does this hurt? But that's not functional.
No, not at all. And that's
Hmm.
the other thing that I've been really, because I was taught non-weight bearing most of the time.
Okay.
That was one of the things that my teacher taught me that was the most profound, was to treat the foot in weight bearing, to do
Hmm.
functional manual therapy, which is what the modality was, in weight bearing. And that just opened my eyes.
Yeah,
Um,
that's
there
huge.
are a lot of things that I've modified since then because, you know, weight bearing can even be lying down with your feet on the ground. That's not true weight bearing, but it's better than non-weight bearing. It's more
Ah,
functional than non-weight
okay.
bearing or sitting.
Yeah, that it does
I'll
make it
have
a
my
little
patients.
tricky to like
Oh
I
yeah, do it on
for
yourself.
doing
Yes.
yourself. Yeah.
Yeah, for sure. Now, even because of the yoga work, a lot of times I will, and again, this isn't for everyone who doesn't have the range of motion, but I will treat my foot in butterfly because it's closed chain, because the foot is against each other or
Oh,
against the yoga block.
really?
Hmm. So I'll
Oh,
do mobilization in butterfly, and
oh,
now There's one yoga pose in Bikram called fixed firm. It's really a W seat, which again puts you into patterns. And when I'm in that, you're on your knees. You know what a W sit is? It's when your knees are together and your butt's in between your feet. You're
I call that child's pose, but
no. Yeah, but your feet are out. Your feet are out to the side.
Okay.
Yeah, feet are out to the side, butts in between your feet. And then
Okay.
you're supposed to reach back. I can't go that far, but I can get down to my foot. And I mobilize every time I'm there. I'm going to bring a crystal to next class so I can get in there a little bit better.
Oh, so it's sort of like camel?
It's like camel, but your butt is on the ground.
Oh. Oh, okay.
I can show it to you. Here.
Okay.
I have my
I think that's some severe internal rotation there of my femur. I don't know if
yes,
I don't know if it's gonna, my knee's not gonna like that.
no, not at all. Most people's doesn't. And so it's that. Together,
Oh,
the feet apart, and you go back.
oh,
And
okay.
so when we were just kind of talking about patterns, and in my training, I was taught by individuals who worked pretty much directly underneath the creators of proprioceptive neuromuscular facilitation, or PNF. A lot of people know PNF as contract, relax, or hold,
Yes,
relax.
that's how I knew it.
Yes. And it's really about patterns in the body, and some patterns go with other patterns.
Mm.
So, like, let's just take an inversion of the foot, right? Inversion of the foot.
Can you show
It,
that with your model
with
so
my
people
foot,
know
yeah,
what that means?
I can do that. So an inversion is this way, right? This would be for somebody who has a flat foot. Okay.
Isn't that the opposite?
It is the opposite, correct, right?
Oh,
So again, if you have a flat foot, you're going to be weak in this pattern,
oh, we're weak in that pattern. Got it. Okay.
right? You're going to be stronger in this pattern,
Correct. Yes.
that pattern, okay?
Yeah.
And so there's a pattern that moves from the toes to the ankle to the lower leg into rotation, right? Because the lower
Mm.
leg has a bit of rotation, about 10 degrees, which is super
Mm.
important for the knee.
Okay.
Super important for
I'll
the
work on it.
knee, and will also impact the position of the midfoot, which
Yep.
is crucial for the forefoot, especially bunions.
Mm.
Okay, so there's a movement at the lower leg, then there's a movement at the thigh, then
Yep.
there's a movement at the hip, and
Yep.
then there's a movement at the pelvis. So the
Right.
pelvis is really interesting because we were talking about the infinity sign earlier. And when you're walking properly, the pelvis moves in an infinity sign.
Really?
Yes, I believe the center of
Oh,
gravity is right in the middle of it.
that makes sense. That totally makes sense.
Yeah.
Wow.
So if you don't have that movement, and again, the PNF patterns, they start with both the pelvis and the shoulder. And
Okay.
there were four patterns. There are four patterns in the in the appendicular skeleton, which is the pelvis and the shoulders. And then you have the axial skeleton. The axial skeleton is with the hands and the feet. So when you're in pattern, like for
Thought it was
example,
the opposite, but anyway, go ahead.
yeah, like when you're in pattern, for example, when I lift my arms up, right,
Yeah.
I can go further with my left than my right. That's in keeping in good alignment, right?
Oh, okay.
Now the pattern for this actually, yeah, it is this position of the hands, right?
Mm.
It's this way actually. And if I start into my actual fingers, I'm restricted. That's where I need to start the comprehensive core. Then it moves to my forearm. Then it can get to my shoulder. So again, when people are having shoulder problems, dysfunction could be in their hands.
Yeah, was a really big aha for me when you were teaching me, because we send people to PT or whatever and they have shoulder issues and they never work on their hands and wrists.
No.
Never.
It's the same with the hip and the foot.
Yeah. Yeah.
And, and or the knee and the foot. So I'm very excited to start looking at the patterns, putting people in the different PNF patterns and seeing where their dysfunction lie, going all the
Mm.
way through the kinetic chain.
Yeah, and just for the folks that are coming in late, or maybe people that are still wondering, can you redefine kinetic chain so people in layman's terms so they know what you're talking about?
Yeah. Okay. So the way I look at movement is it's like a row of dominoes, right? And so the kinetic chain is like the row of dominoes for each joint in your body.
Mm.
Okay. So it can start at the foot, it can start at the hand, and then it will move more proximal. Or it can start at the proximal and move more distal, like when you're doing a squat, right? That's a difference. So that's the kinetic chain. And you want the kinetic chain to be able to absorb forces. That's where alignment comes back, right? To attenuate forces so that you don't get an imbalance in any particular area or
Mm.
compensation, which will then cause the instability, which will then cause the, right, will then cause, the inflammation and then cause more instability. And so once again, there's the importance of taking away the irritant, right? The irritant, the inflammation, and then addressing the root cause of it, to permanently undo that particular.
Yeah. It's fascinating to me how that irritant you're talking about is can be really, really far away from where the actual pain is.
Very, very
Um,
much so.
yeah, like so when you talk about like you mentioned squat a moment ago, but if we go back to kinetic chain, kinetic meaning movement, guys, in case you're like, what's that word mean? So for example, if I initiate something at my foot, then it could go like toe, foot, ankle, knee, hip, and above,
Oh,
right?
yeah.
But if you said when I did a squat, I'm starting to squat down, and that's more central. So then
Exactly. So that's pelvis, sacrum, coccyx. Yeah,
it goes down to
down the
knee and
kinetic
ankle.
chain.
Okay.
Yes, yes.
Okay, okay.
Hmm.
Yeah, that's really interesting.
For sure, for sure. It
Mhm.
changes the whole dynamic. Or it also gives you another place to, to look at where the dysfunction lie.
Yes, that's true.
What's the possibility? So, again, going back to my yoga class, head to knee standing, right? So basically, forward bending, which they tell you never to do. But if you do it properly, it can be done, it can be just fine. But I will get like, that nerve twinge in one of my legs. And it's like, okay, at what point does that happen?
Ah.
It happens when I'm at like L4, L5, maybe S1, S2.
Mm.
Oh, that's where I need to work. That's where I
Mm.
need to mobilize
Okay. Yeah.
so
Yeah,
that I
that's
can move, right? Because again, when when you get the sensation of pain, or as a therapist, I see a compensation, right? So maybe at that point, my thigh starts to externally rotate because the body doesn't care how, the body just does it, right? Um,
does the
and
best it
the
can.
higher self just does it right. Maybe that's what I'll call myself, higher self physical therapy.
Yeah, well, yeah. Well, I had been, doing some CrossFit exercises with James, and his body's relatively balanced except for a few foot things here and
Mhm.
there. So he rarely has any issues. I tend to be a little bit more overly flexible in certain areas, and so I do have some challenges after, like for example, if I do like 700 squats or something like that. I mean, not all at once, but in the
Mhm.
exercise, sometimes the next day I'll feel like this line from my gluteus down to my foot that's tight. So
Mhm.
that is my body was like, I know you thought you did this correctly,
Mhm.
this whole, and it felt fine at the time. There were probably some compensations there, and therefore the next day there's some
Mhm.
tightness and there's some unhappiness.
Yeah, yeah. And I have to say, I think the reason why I like this studio that I go to is because we use straps and blocks. And when you
Mm,
do that, you can actually have a sensory or a tactile, right? cue to keep you in the right position.
Okay.
So that way you're more able to feel when you go out of alignment. And again, some of the stuff, because it's a lot of times it's a counter where you need proximal stability, meaning your core needs to be stable and not moving, right? To have that distal mobility. And so using a strap to maintain core engagement can be super powerful, or a block, right?
Mm.
Because when you're contracting one area, you can't compensate, you won't compensate for it, because it's it's giving you that cue to, oh, okay, when you squeeze the yoga block and then you move and then the yoga block becomes less squeezed, that's your compensation, that's your point
Ah.
where you need to treat.
Okay, okay. Well, I'm gonna be honest. Sometimes I'll just think, oh, I can do it this time, but then I'm not rehabbing myself. So we did wall balls the other day, and I know James goes down in this humongous deep squat. And at least I was like, okay, Karen, you're not doing that. You can, doesn't mean you should, because I
Mhm.
know I'm probably compensating and my
Right,
iliacus gets a little inflamed after going down because you taught that after a certain degree of squatting, like there's this power area, right? And then
yes,
beyond that, you go beyond that, now you're in the weak area. And I
right,
shouldn't be training the weak area if I'm not really
exactly.
consistent and balanced and aligned in the power area.
Exactly. That's why I was just talking about, in other classes, I was going all the way down to the ground. I was getting my head on my knee and this and
Yeah.
that. But my dysfunction, like today, I got down to about here without compensating, because my body wanted to go this way, but I kept it
Oh,
here.
wow. What
Yeah.
awareness.
And like
Yeah.
I said, that's darn hard, because you're working on those tiny small muscles that are stabilizers. And when they haven't been worked, or they have been showered, let's just say, by inflammation, they shut down. And so that's why it's so important to take away the inflammation and then stabilize the muscles. And
Mm.
this is where, you know, so many people get it wrong. And when you have surgery, what does surgery do? What happens after surgery? You're swollen. So many people do not restore their stabilizing muscles after surgery,
Mm.
because potentially, I think, those exercises just aren't sexy. They're
They're
just
not sexy. They
they
really
are
are
just
not
they're not
sexy.
sexy.
No one's
But some
taking
of
a
the
real.
yeah, I mean, the most I'll put it this way, the most powerful exercises are just not sexy. But they're powerful and they're tough. They're really, when you are in a position of dysfunction and you are undoing compensations, it's tough retraining. It's really tough retraining. It's like awakening this sleeping giant that's been
Yeah.
hibernating for
Yeah,
for
nobody's doing a
years.
reel showing their
Oh
their
yeah.
hallexus flexor longus working, or whatever, your
Could you
dorsines.
imagine?
Yeah, no. Okay. Okay, working
You're
out today,
pressing.
guys. I'm sweating hard. You see this toe just going like this. And you're like, what is that guy talking about?
Even
Yeah,
yeah.
and I gotta tell you, the ego does get involved. I hate to admit it, okay, but I'm looking at James, I'm looking at the others, the skating coach, and they're doing these exercises, and of course, I just want to do it like them, right?
Mhm.
And so for me to go, wait, I'm not going to do this exercise. It looks like I'm copping out. It looks like I am, like, I don't know, giving up. But
Mhm.
then I really need to stay firm and go, I'm out of alignment. And I can feel that I'm out of alignment in this exercise.
Yeah.
So I'm not going to go down as far, or I'm going to do a lighter weight or whatever. And I'm not yet there in the discipline, going to be honest, because I'm competitive. And,
I have to,
and sometimes the coach will be like, well, hey, how come you're not doing that?
yeah, suck
You
it
can
up,
do it. You
Karen.
can do it.
Yeah, that's the thing too. You have these trainers who are like, oh yeah, you can do it. And I
Don't
go
give
back
up. Come
to
on, let's go.
I
Let's
go
go.
back to the Nike commercial, just do it.
Yeah.
Okay.
Just
And I'm like, okay, well, how many of those athletes from the 80s are now arthritic and crippled?
yeah, thank you very much. Yeah.
And the funniest thing was just the other day, I was walking into the supermarket and I had been thinking about this because I believe that my motto going forward in my movement is just do it right. No,
Mm,
because just doing it is not good. And we've
no.
been, as a society, and I'm
Yes.
not just talking about exercise, we've
Yes.
been just doing it and
Yep.
not doing it right, not doing it consciously, not thinking about
Yep.
what we're doing. And as a result, I think we are where we are as a society.
Yeah. So true. Great
And
advice.
again, I could go back to the construction of my house or the construction that I see going on in my community, and then the destruction that I have witnessed just recently. Also, I mean, uh,
Mm.
you know, there's something to be said about soil absorbing water and concrete
Yes.
not absorbing water. Um,
Right.
yes,
Nature versus what we think,
right,
humans have this thought, well, I just want to make it look this way, but it's actually
right.
not in alignment with what nature needs to do.
Exactly,
Yeah.
exactly. And I am going to be doing some things in my house, and I am
Mm,
consciously thinking about that because I
nice.
am not going to contribute to this problem that I'm
Yeah.
seeing. But what was really, really funny, and I'd like to kind of end on this, is that, I've been thinking about this, just do it right, just do it right, just do it right. And sure enough, I'm going into going into or coming out of the supermarket, I believe. And there's this woman, and I can barely see her shirt because she's literally like, what? Like walking like this. And she's old, she's an elderly person, right? And she's just like, I mean,
Yep.
she couldn't have been walking more dysfunctionally. And you know what her shirt said? Just do it.
Oh my God. Wow. Wow.
You cannot make that up. You
Yeah, I
cannot
saw all
make
sorts of
that up.
dysfunction in the airport and these like different age group people, and it was just like cringe. And here I was hobbling slightly, from my little, airport
Mhm.
incident and realizing I need to get back to, well, first of all, not
Basics.
run, but get back to an alignment and being really conscious of movement. So if you were gonna like summarize, I know we're getting to the end of this time, but summarize kind of like that overview of that 4 steps,
Oh, yeah.
to helping people solve pain in their
Yes.
foot, what would you say that would be?
It would be, the thing I learned in first day of class, with modified, of course, release or free, connective tissue, negative mindset,
Mm,
any sort of energetic stuff. We're talking to your community here. So any sort of energetic stuff, free, inflammation, right?
mm,
Both metaphorical inflammation as well as physical inflammation. And then realign, right? Obtain the proper alignment. You don't know what you don't know, but I know what you don't know. So join Correcticize, corrective alignment therapy, right? Corrective alignment therapy to understand, okay, well, how am I supposed to stand? Like I
yeah.
learned in that class. I didn't know that I was wasting all that energy by being, misaligned between my pelvis and my rib cage, and no idea until I learned the right thing. And now I know that's one of my tendencies. So I am
Mm,
super aware of that. I know
mm,
what my body likes to do, what's comfortable for it. Then reinforce. Okay, so you need to reinforce the release and the realignment. You might need to release further, right? You might need to realign up or down the kinetic chain, right? So you need to reinforce that and create that stability. Okay, because again, what you have to free the inflammation. You're never going to get stable until you free the inflammation.
okay.
Okay. You're never going to also take away or improve force attenuation until you align. So you need steps 1 and 2, then you reinforce it, right? And then you reset and then go to the next part. And
Mm,
again, I believe this is in body, mind, and energy.
That's
release,
beautiful.
realign, reinforce, reset, go to the next level, release, realign, reinforce, reset, go to the next level.
Aha.
And I use this, when I was struggling with a tooth issue. I'm like, okay, there's a lot of history here. What do I need to free? Right? What do I need to free from this experience? I had to free the old story. I had to free the old experience. I had to free that timeline, right? I had to align then to a new timeline. I
Yep.
had to align to a new mindset. And I went back to the surgeon who malpracticed me, as a matter of fact.
Wow.
And that was big. I forgave. I let that go and
Wow.
went back to him because I felt that it turned out that he this time diagnosed me properly. Um, and honestly, it was very healing for me to do that.
Mm. Good for
Um,
you.
so release, realign, then reinforce that. And in this case, it wasn't physical, but it was information.
Yep.
Okay, I released, and I realigned into a different mindset. Okay, how do I reinforce it? What do I need to do to stabilize the situation? Who do I need to go to? Right. And sure enough, my dental crisis, took about 10 days to resolve. And yes, I was, uh, $840 poorer, but it could have been 3,000. And what was interesting is that I realized that the root cause of my problem is the alignment of my teeth.
Mm. Yeah, wow, great awarenesses so that you can teach it. Sometimes we
And
go
that's
through stuff so we can teach it.
I agree 100%. I agree
Yeah.
100%.
So share with people where they can find you. We'll put the links,
Oh,
of course, below this video.
yes, for sure. I mean, there's a bunch of different ways to find me. And again, the links will be below. Hopefully, yeah, I would get the opportunity to, interact with you, answer questions, join my community. I'll put my socials on there, and we can reconnect at a later time when it aligns.
And well, and then what's really great is if people really want to, and in addition to you teaching them what you know, right, and empowering
Yeah.
them with your amazing correct to size program, they can also get a Zoom consult with you.
That's right. Right now, I offer it at a very reasonable price. It's an evaluation strategy consultation. It's 30 minutes on Zoom. And in that consultation, I do my best to determine the root cause of the problem, that irritant, right? And again,
Mhm.
it may be in body, it may be in mind, it might be in energy. Oftentimes, it's a combination of all three, because I believe they are all connected, just like those patterns that I was talking about.
Yeah, yeah,
Yeah.
yeah.
Yeah. So I'll put that link below as well. All right.
Perfect. That's great. Well, DL, thank you so much for your expertise. It's always wonderful to connect
Yes.
with you, learn from you, and I'm like the sponge. And I think just having you here just makes me a little bit more accountable to do what I know that I'm supposed to be doing.
Right.
And I mean, granted, I have been doing, but I could be more consistent.
Mhm.
Yeah, and I got to tell you though, when I see you in person, I'll show you some of my foot exercises that I can actually do now,
Yeah.
because you said it was good to do.
There you go.
Yeah,
The
yeah.
unsexy ones.
The unsexy ones, definitely.
All right.
All right. Thank you, DL, my
Can't wait.
friend. Thanks everyone for
Thank
listening
you. Thank you.
in. We'll
Thank
see you
you.
back in the light medicine community, and we'll see you next time on Light Warrior Radio. Bye for now.
Bye.